Thank you, Dr. Alexakis, for this presentation. And if there are any questions from the audience? Do you want to ask something?
Otherwise, I have a quick comment. We had a large series of referred patients with supposed MDI to Berlin, where I work. And we took them under dynamic fluoroscopy imaging to see in a kinematographic analysis where they actually dislocate. And it's quite amazing to see that many of the patients that were referred to us had a multidirectional laxity, so they were unstable in different positions, but they dislocated only in one position, which was mostly posterior. Do you have a similar observation, or do you feel like anterior is more common?
I have said some there. The posterior element is very common.
Very common.
Unlike the original, we must always detect where is the position of where which dislocation produce symptoms. What is the pathological? It's very difficult, I believe. You must have a very good communication with your patient, to a very good examination. I believe the clinical examination is the main point to decide what to do with an MDI.
And please, there's a question.
MRI won't help you.
That's true.
It's not a question, just I would like to support this opinion, because according to our physical therapy evaluation, mostly we found anterior mobilization of the head of the humeral and very tight posterior collagen tissues, even for MDI. Mm-hmm. And sometimes we have to mobilize the head and to centralize the head on the shoulder from the interior position to the central.
Yes. And one last question, or is there one? There, please.
Sorry. Is there a number of sutures limited to do the plication, or you want to put as much you want? Both anterior and posterior, you want to put plication?
You start from the bottom, from let's say around 6 o'clock, front back, and you go up. And you put as many as needed. Usually you may put up to 4 or 5 anchors if you put anchors. It's a matter of cost also at the end.
Sure. Both anterior and posterior?
Both. You go front back from the bottom to up.
So you start from the 6 o'clock,
that's the only way to put the head in the middle. If you tied the first, let's say the front, you may put the head in the back. You may push the head back. You have to balance.
Thank you very much.